Hello, this is Dr. Lance Von Stade. I'm here with Dr. Adrian Villalba at Golden Gate Chiropractic Center in San Francisco. And we've worked together for a couple of years. Dr. Adrian is a perinatal chiropractor, and I work a lot with the prenatal population and help with recovery in the postnatal period. And we are going to be separating and splitting ways very soon. And I wanted to take advantage of Adrian while he's here. His brain is incredible, and I want to try to soak it up. And so I thought I would do so in a way where we could also share all this wonderful knowledge, because I'm going to be stepping into a role where I'm taking care of his people, and I want to do as well as I can to serve them the way that he's been serving them. And also, I think as we get into this conversation, a lot of things that perhaps we haven't even spoken about, or that he hasn't had opportunities to share with people, get on the table, and we can start to get them out to the people that need them. So when you find this video, feel free to reach out to us to ask questions. You can send comments, you can get in touch with us, and if you have questions, we will also continue this conversation on so that we can help people get their needs met. So for those that don't know you, give a little background. Why are you a perinatal chiropractor, and where are you headed, and what's going on in your life?
Yeah, so like Lance mentioned, perinatal is the period around pregnancy and birth. And so I've always pictured or thought of myself as a father, myself as a family man, and have been very much looking forward to this time of life. Then when I became a chiropractor, I thought, oh, I'm going to be a sports chiropractor. I'm a dude. And so I have a lot of like movement background. I have a lot of extremities background, so anything but the spine. But as I went through my clinical period in school, the most fulfilling case that I came across was a patient of mine that became pregnant under my care. I saw her through her entire pregnancy, and then a couple months after in the postpartum period, and her baby. And it was just so fulfilling for me that I knew right away that it was a good way to spend a life, and a really fulfilling way to be able to contribute to a family's journey. And there's nothing else that screams vitality in life more than the birth period and the whole process. So it's a really beautiful thing. It's a really treacherous isn't the word. There's a lot going on, and there's the extreme highs and extreme lows, and I've experienced a lot of that. And so it's beautiful. It can be scary. There's just so many emotions that come from this period, and to be able to help guide or just to be a signpost in their trail of this time period is why I'm choosing to dive deeper into this process, because we're constantly learning, both of us, and this is just something that piqued my curiosity early, and I've just tried to go deep.
Yeah, awesome. For a little explanation on me, why am I so interested also in the perinatal period? I have a couple kids. My wife is a stellar human being, and I trust her with all my heart, with everything in life. And one of the things she said to me after our first child was born was, you're never allowed to see a pregnant woman and not tell her you can help her as a chiropractor. And so she's a social worker. She's not a chiropractor. I was, I think, her first chiropractor. And now she really touts it as something that helped her get through and enjoy more of her pregnancy, pre and post. And now we have a second. And Adrian got to take care of Monica for the most part throughout her pregnancy, and she was like, I do not want to miss these opportunities. She would, drive across the city to go see him and make it a priority. And she also, after talking to her a lot about why is it so useful to her, she has said that she doesn't want to be distracted by the barrier of pain when she's trying to be there for her baby. She doesn't want to have to think about herself when she wants to provide for Connor. And so that was the big aha, that this is perhaps the most special time in a woman's life. Definitely, even for myself as a parent, that time is so amazing. You want to be as present as possible. And the body goes through so much that it's nice to have someone that can help the body reconnect to itself, so that it's not distracting you from breastfeeding, distracting you from just holding and looking at your baby. And so we want to try to provide resources, especially in the movement realm, because how you're lifting, bending, carrying, twisting, and tossing, all the things that you do with your baby, how do you do that in a way that's safe so that you can enjoy it, and so that you're not little by little breaking down and not realizing it until it's so bad that you can't even manage the stress that comes with a crying baby, a baby in need, or a husband in need and a baby in need, or a wife in need and two babies. Yeah. So how do we build more resilience to the stress of that time? How do we build adaptability into the body? And we are a resource, and we're going to continue to build more resources that you can do on your own so that you enjoy that time as much as possible.
Yeah, and that just speaks to pretty much any situation in life, and being aware of the complexities that come with pregnancy is the only difference here. Moms are humans too, is something I like to say, and they need support during this time. And there are a few little tweaks that you have to take into account while taking care of a mama or mama to be. But all the things that you mentioned are things that people just need. They need to have less interference. They need to have more resilience, more resistance, more resources, or just be more resourceful. And so as chiropractors, that's what we do. And as a perinatal chiropractor, the only difference is we're acutely aware and in tune with and listen for the special needs for moms.
So what are some of those special needs? And what are the accommodations that you make? What are you even mentioned earlier, the highs and the lows that you have experienced yourself? And can you paint a little more picture of what goes into that?
Sure. Let's say the most superficial needs, pain, like you were saying. They want it, moms, for the most part, when they come in, want to get out of pain. And so back pain, headaches, insomnia is a pain, reflux, pelvic pain, anterior groin pain, sciatica, leg pain, extra weight causing back pain. The moms, even before they have given birth, they already starting to get kind of those rounded shoulders, and the mom bod that you hear a lot about is basically holding a baby, nursing a baby, looking at your baby. Everything's bringing you into this rounded position on top of already a rounded kind of culture that we're in. Those are the most superficial pains. And then postpartum, it's more of the mom bod. It's inflammation with the birthing process. Breastfeeding is a big one. And then diastasis recti is another one. Diastasis recti, some people say it differently.
Yeah. What is that?
It's the separation of the two 3-packs on each side. So you have a left and a right set of muscles, and there's a ligament in between those muscles, and they stretch out when you have increased intra-abdominal pressure. And so when you have a baby, that increases that pressure. So anyone can get it. It's just you're at a greater risk during pregnancy. So
are there any other risk factors for that? That predispose a certain person from getting it versus another? Sure.
Posture is a big one. Anything that increases your intra-abdominal pressure. So weightlifters can get this. A lot of athletes can get it.
For pregnant moms,
for
one
pregnant moms.
mom versus a different pregnant mom.
They haven't really found much on besides postures, besides certain movements that will increase your risk, and it's a matter of load. So repetitive load, everything that you're doing constantly, things that you do on a daily basis. If you're doing those that in a way which increases that load, it's like your abdominal cavity is like a can. And on the top you have your diaphragm, on the bottom you have your pelvic floor, in the front you have your 6-pack abs basically, and then the back you have your spine. So usually the back is pretty solid, and the seams on the other 3 parts of that can, depending on if they're weak or not, or too strong, that's where moms end up let's say bursting out of their seams, for lack of a better term. So the front, you can have the diastasis, where there's a separation. On the top you can have a hiatal hernia, where you start to experience more reflux. And on the bottom you can have pelvic prolapses, which are never fun, but definitely an increase. Incontinence is one of the big ones there. You hear a lot of moms like, oh, I sneezed and then I peed my pants a little bit, which is very common. And I don't know how, it depends on mom's comfort level of whether or not they say something. Yeah. And so there are things that you can do for it. Obviously you can't completely eradicate everything, but there are ways of moving, there are ways of being intentionally that can decrease that risk.
Yeah. So if you were going to say, mom comes in for chiropractic care, they come in because of this superficial need for pain, which, I mean, when you're feeling it, it doesn't seem like a superficial need.
Yeah,
it's
no.
like it's
superficial in the layers.
Yeah, because we know that you're not born with it, so there's a cause of it, and we can get into that, I imagine. But what can someone expect? What are you thinking when you're analyzing someone who's pregnant? You're obviously there's two people involved with that analysis, and how do you take that into consideration, and how do you build a plan, and kind of what's the landscape that someone would be entering for chiropractic as a pregnant person?
Right. So we have in our office we have ways of kind of getting a bigger picture of your overall health. So there's form, function, and
feeling.
That's right. And so how you feel plays a big part into this, right? Your pain, how much is how much is this pain taking away from you being able to experience the life you want to experience, to be able to connect with your baby, connect with your husband, connect with whatever it is. That's part of it, right? And then function, we look at the way you walk, the way you move, the way you bend over, and your actual ranges of motion. We actually see how it is that your body is working to determine, are these motions the issue, or are they affected by some other cause? So taking a good snapshot of that, and then also relaying it to the mom, so that they can see for themselves. It's kind of like listening to yourself on recording. You never like it, but it does give you a certain amount of feedback. And then lastly, it's the chiropractic check, making sure that you're balanced from top to bottom, forward, backwards, left and right, making sure that your pelvis is moving well, making sure your spine is free and clear of any sort of subluxations, anything that's interfering with your body's ability to tell your brain what's happening. And that's just the chiropractic specific exam. And so by helping moms be a little bit more balanced, that disperses the tension patterns throughout their bodies. And just from that, pain relief is a wanted and very predictable side effect of what we do, as you very well know.
Yeah, cool. So to recap that, someone comes in, they're going to get this comprehensive functional exam. You're identifying how are they feeling, how are they functioning, and what's their form or what's their posture, how are they carrying the weight, and how are they loading gravity into their body. And you're using the tools that you've analyzed to show them and reflect back to them, so they can see how they're squatting and moving and sitting and posture and walking. And what are some of the other important things like in their life that you think that would be important they're listening to and looking and getting reflections on? I imagine different positions of sitting, but once baby is born also, we've shot these videos for the Mama Movement series, because a lot of the people who come in, they're like, man, every time I put the baby in the car seat, every time. So can you talk some of those needs?
Yeah, so I guess that's just it. It's like, can you correlate certain movements, certain times of day, certain activities that you do where you're starting to notice your body, right? That's like when I have to think about my back, or when I'm putting my baby in the crib, and that's when I'm acutely aware that something's going on. Those are the types of movements that I would say you should focus on. So for us, the ones that we see come more frequently than others, just sitting, or like getting up or going to sit, getting up from or going to sit in a car, in a chair, on your bed. And how often do you do that? And you don't think about it until someone tells you to think about it, or unless you're having a little pain as you do it. Like, I'm fine, but as soon as I go to stand up, that's when I feel it. Getting up and down from laying down, that's another big one, which also has a increased risk depending on how you do it. That is one of the major things that increases your risk for diastasis. And so that's something that we go over. That's something that's shot in the Mama Movement series. Other things, I think, obviously, I think the culture that we have of anything tablets, anything computer, anything that you're hunched over and looking down, when you come back up, that's when, can you even stand straight up? It's hard if you're in this position all day long. Other types of movements that are baby postpartum, there's, I think, more. Everything. It's everything, right? Because not only did you just go through a marathon in birth, but then you have a 10 ish pound weight that's just wiggling around, crying and needing you, and you're not used to just carting this thing around.
And the thing I've noticed most is like, even if it was a 10-pound weight, it'd be one thing, because I'd just be like, huh, and forget about that part of my body, and then get things done. But it's a baby. It's
you have to
like this.
it.
I put myself in these crazy weird positions to accommodate and shape myself to the shape of this baby, so that it's floating in its nervous system. And then I realize I can't hold this for longer than 10 seconds comfortably.
Right.
And then we've had to put together different positions that you are supporting yourself, and your spine is still long, and you still have breath, and you're using your hips to hinge instead of bending from the spine. And what's the progression of the Mama Movement series? So what are some of the exercises in? You've already talked about the things that prevent Diastasis Recti. I know that how to put a baby into the crib is a part of that. What would someone see and experience in the Mama Movement series that you think would be worth mentioning?
Well, the foundation of it is breathing. Right? It's are you holding yourself up, or are you falling into a position? So posture just means position, and if you are letting it happen to you, gravity is going to take hold. The gravity is going to win every time. And so can you inflate your system with your breath to where you're actually active, which you're holding your bones up under your own power, versus your bones holding up the weight of your muscles, the weight of everything that's on your shoulders. Because that emotional stress is definitely on top of you. And so that is where everything starts. Can you breathe properly? Can you breathe gently yet effectively? And then can you stop thinking about it? And then from there, it depends on, we have the series, which is a pretty blanket progression, or when mamas come in, depending on how they did in their the functional part of their exam, we'll tailor it to the most important needs or the most imminent needs. If like it hurts from sitting to standing, we'll start there. If it hurts when you're bending over, we'll start there. But for the most part, everybody gets how to go from the floor to standing, how to go from your bed to sitting, how to go from sitting to standing, and then how can I start to squat so that I have that available during the birthing process. Squatting has been shown to be really, really effective in progressing labor. And then once you actually go into the labor itself, or the birth itself and the actual pushing part, it can increase the risk for tearing. But you just never know what's going to be comfortable for you as a mom. I know that I drilled it into Lena, my wife, to be able to squat like that. And then once the time came for her to labor, she never used it. She didn't want to. But I always tell moms, I think it's just better to have it in your back pocket just in case you want that.
The ability to squat.
Where it's not going to hurt you. Which is it's a position, as we know as chiropractors, the general population is just not very good at doing, or they've never been taught. And so it is a movement that requires some practice. So that's,
which is, just to touch on that, because if you look at your 3-year-old, perfect squat. So it's a default movement pattern that we have as humans that we unlearn by how much practice we have sitting and collapsing. And then we have to relearn later, unfortunately, and it takes practice. It really does, because you have to start to reorganize the order of firing of certain muscles, and when you're carrying things, and range of motion and all this kind of stuff, the interference patterns. And it seems, so to kind of break that up, it seems like breathing is number one. Transitions seem to be really big. Sitting to standing, standing to sitting, squatting and getting up and down off the floor, in and out of bed. And then preparing for the birth process, range of motion, squat patterns, different movements that you might want to explore when you're in labor. You don't want your body to be a limitation to you going to the place you wish you could go.
Exactly.
You want to have the freedom to move and do whatever nature needs you to do in that moment. Awesome.
And then postpartum becomes all of these movements with a weight. Right? So the better you get at doing it without weight, the more practiced you are, the easier it becomes, but it's not impossible. Like there's moms that come to us after have given birth, and we start right at the beginning again. And then you just have that extra weight. So one of my catchphrases is just because you're not wearing yoga pants, or if you are, and you're not lifting an actual kettlebell or a dumbbell, doesn't mean you don't have to think about your form, or you shouldn't think about your form, whether that's moms or dads, because we get overlooked a lot. And we're carrying that weight too, which is usually pretty new for dads. And so we have if we have a tiny bit of intention in our movements, we can have these movements get us to be stronger or make us stronger versus, like you said at the beginning, slowly breaking us down.
Yeah, it's humbling to be someone who does lift kettlebells and does lift weights, and then I have my 10-pound baby and I'm exhausted. Because it's just little movements, little bouncing, constantly rocking, his head's going this way, so I have to be adapting. It's a full body activity.
Absolutely.
Even though I want to be trying to make coffee or do whatever else I'm doing while I'm holding him.
And we're not the primary caretakers.
No kidding. It's and I didn't go through the birth process, and I don't have the relaxin that changed all my lever arms in my body, and it's a whole new body that is also, the brain is trying to adapt to learning how to control, how to rebuild stability, then how to work mobility again. And it's not even about you in that time, because the moms get so overlooked because it's all about baby. And just like mom at home, Monica has said, I don't want to think about myself. I want to think about baby. And the thing that comes to mind is, if you want shade in 20 years, you got to plant a tree. If you don't want to have to think about your body, when baby is here, how are you preparing for that? Ranges of motion, support systems, practicing, and building little programs or having resources like Mama Movement that you can be using in times when you're feeling good, so that by the time something's going down, you have resources and practice and strategies to apply immediately.
Right.
Yeah. Okay, cool. Well, I think this is a good first round.
Yeah.
We're going to kind of break this down and see if any other questions come up just from within ourselves. We'll share this with some of you guys and see if you can come up with any questions as well. And let us know what they are, because we just want to help as much as possible. The words of Monica are just ringing so true to me. I don't want moms to have to be in a place where they can't enjoy the process. The dream that they have been working toward, their baby is here and they're distracted by the pain that they're experiencing in their own body. So if we can help with that, then you get to experience the deep needs of love and connection and fulfillment. So let us know how we can help, and we'll keep coming at you.
Yeah.
Cheers.